In this video, I'm telling you how to reverse your prediabetes. It can be reversed. I'm going to tell you how. Guys, I'm Dr. Jen Caudle. It's good to see you. Let's first start with the definition of prediabetes. And don't worry, we're not going to spend a lot of time on this. But if you don't have pencil and paper, I want you to get it. Let me give you the numbers. So when you look at your lab work, you know what you're looking at. First of all, prediabetes means that your blood sugar is too high, but it is not high enough to be considered diabetes. There are two main numbers your doctor is most likely to check, okay? One is the fasting blood sugar number, okay, your fasting glucose. That number should be less than 100 for a fasting lab result. For a normal sugar, that number should be less than 100. Prediabetes is between 100 and 125 for that fasting blood sugar or glucose, and diabetes is over 126 and above. Now, let me tell you another thing that your doctor may order. Oftentimes we do. This is the hemoglobin A1C. This number, normally, if you're not pre-diabetic or diabetic, this number should be 5.6 or less, 5.6% or less. Prediabetes is 5.7% to 6.4%. Diabetes is 6.5% above, okay? That's the first thing, all right? But now, let's move into how you can reverse prediabetes. By the way, I'm going to link another video here that talks more about prediabetes, what it is, etc. First thing, you got to eat healthier than you likely already are, okay? One of the ways that we become prediabetic is that we eat or take in too much sugar by mouth. What is sugar in? It's not only in sweet foods, but it's in breads and pastas and things like that, carbohydrates. So eating a lower carb diet is likely going to help you reverse prediabetes. That means cutting back on the sweets, the carbs, but also specifically things like fruit juice, soda that's full sugar, iced teas that are full sugar, cereal, candy, all that kind of stuff, but also breads, pastas, etc. Let me give you some diets that I love. These diets are excellent. I'm going to link more videos here with these diets. If you don't see them, by the way, just message me. I will send them to you. I love the Mediterranean diet. I will link that here. I also really love the DASH diet. I will link that here. And then also, many people, keto diet works as well, although not everyone can tolerate doing the keto diet. And I have a video on that, so I'll put that one here too, okay? So the first thing is low carb diet. There's a total of 3 suggestions that I have. And literally, by doing these things, you can reverse your prediabetes. The second thing is, okay, you need to exercise. Exercise is absolutely key. Absolutely, absolutely, absolutely. You must exercise. Exercise not only helps reduce your risk of prediabetes, helps you reverse it, but helps so many other things, your heart, etc. And by the way, don't go anywhere because I'm going to tell you what the symptoms of prediabetes are, as well as some of the risk factors as well. Moving forward, let's talk about the last piece of this puzzle. Weight loss. That is right. Reducing, or rather reversing prediabetes often comes down to weight loss, and eating a healthy diet and exercising often is part of that. Losing weight. There have been studies that have shown that even losing 5 to 7% of your body weight can literally reduce your risk of progressing to diabetes by 58%. And that's one of the risks of being pre-diabetic, is that you can become diabetic. And I have many patients that if they don't make changes with their prediabetes, they don't make lifestyle changes, they do and will progress to diabetes. So one of the ways that you keep from progressing, and we're talking about type 2 diabetes, one of the ways you keep from progressing is you work to reverse your prediabetes. One of the ways you do that is eating a healthy diet, exercising, and losing weight. Now, there are a lot of FDA-approved excellent medications on the market to help with that. Nutritionists, etc., can help with that. Now, let me tell you, the symptoms, okay? Symptoms of prediabetes, there are not necessarily any symptoms. In fact, Most people don't have symptoms of prediabetes. So do not rely on that to tell you how you're doing, what your numbers are, because that's not likely going to be the case. The other thing is who's likely to convert or be pre-diabetic. There's a number of people who are at risk, whether it's people with polycystic ovarian syndrome, people with other underlying conditions, etc., age, race, etc. I'm going to link another video here with those risk factors because I want you to know it. The other thing I should say is a website that I love that has really, really great diet and meal suggestions is the American Diabetes Association. Go to the American Diabetes Association website. Even though you are not diabetic, they have great resources. I want you to check those out. Write in the comments if you've been able to reverse your prediabetes. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. Subscribe to my channel. Follow me on Facebook, Twitter, Instagram, LinkedIn, TikTok, you name it. Also, go to my website, sign up for my free weekly health newsletter, drjencaudle.com. Guys, I'm Dr. Jen. Did you reverse your prediabetes? Let me know.